Hello, Dr. David McFadden from the Dental Implant Center in Dallas, Texas. Today I want to talk about dental insurance. I know that the average patient thinks that having dental insurance is fantastic. And for some people it is. If all you need is a cleaning or a filling or a crown once every few years, it's good to have dental insurance. But there's a buyer beware attached to that. I tell patients, think of dental insurance as icing on the cake and not the whole cake. The reason I say that is that when a dentist signs up for an insurance plan, they agree to reduce their fees by anywhere from 50 to 80%. So how does a dentist make money if they're reducing their fees by 50 to 80%? I can tell you that our profit margin is not that high. So the only logical way that we can change our profit level is to spend less time with the patient, delegate more work to the assistants, and use cheaper labs. That's the only way the numbers work. So and I think that the average patient also thinks that if you get a crown from me or a corporate office, it's all the same. And that's not true. That's kind of like Walmart thinking. We're not buying a toaster or a set of tires that we expect to wear out and we expect to replace those. We're buying a medical device. You, the patient, are purchasing a medical device that will be in your mouth, hopefully, for decades. So when I said earlier that the dentist cuts costs by using a cheaper lab, you're not getting the same crown at every office. A crown has to fit your tooth almost perfectly to last a long time. So you simply can't cut corners in these procedures that have to be so precise and get the same outcome. The average cost of a dental crown is somewhere between $25 and $600. That's the price that the lab charges the dentist. So think about that for a minute. Some dental insurance plans don't even give the dentist $600 for the whole procedure. So where do you think they're going to make up the difference? They're going to make it up by buying the cheapest crown they can find. That does not serve the patient well. So this mentality that you're going to get the same quality, all these different price ranges, it's impossible. It can't happen that way. So I tell patients, or even my family members who call me from other cities trying to find the right dentist, say, go online and read reviews, find a fee-for-service practice that will submit your insurance. You'll still get your normal insurance reimbursement. Your out-of-pocket cost will be a little bit higher, sometimes significantly higher, but again, you're not buying a disposable product. So buyer beware. Do your research, make good choices, and still use your insurance. Thank you for listening.